Hello, my name is Mark Block, and I'm Chief of the Division of Thoracic Surgery in the Memorial Cancer Institute in Hollywood, Florida. We see a lot of patients with lung cancer, and so I go over a lot of information with them about how it's diagnosed, how it's treated, and review their films with them. I thought I would put down in video format some of that information so it's easier for patients and their family members to review. They don't have to remember everything from our visit. And hopefully, if you're just diagnosed or know someone who's just diagnosed, this will help you to understand the right questions to ask. In other videos, I've discussed lung cancer staging, surgery for lung cancer. So now I'd like to review imaging for lung cancer. Imaging is so important in how we understand, diagnose, and treat cancer that I think it's very helpful for patients to understand what those images mean, how to look at them. It will help them to understand their disease better. So this is a CAT scan through the chest of somebody with a lung cancer. Now, if you're standing at the foot of the bed, then you'll know that this is the backbone here, this is the breastbone, the front of the body, this is their right side, and this is their left side. Now, I currently have the imaging set so the contrast will show us the soft tissues of the body, the bones and the muscles. You're probably familiar with this. Playing with images on your computer screen, you can change the contrast, and we can do that with the CAT scan to see better different parts of the body. So we can see here very easily the bones. These are the ribs, the backbone, and the ribs on the left side. This structure here in the middle is the great vessels at the base of the heart. And then the lungs. Now the lungs are mostly filled with air, so they show up black. We don't see much detail inside the lung. Now what we can do is move up and down with our imaging, and you see these structures that tend to move through the lung as I do that. Those are the main blood vessels going in and out of the lung. Now if I want to see the lungs with greater detail, I can change the contrast. That's the same image, just a different contrast. Now you don't really see the bones and the soft tissues very well, but you do see the lungs exceptionally well. This is a normal appearing lung. In other words, this lacy pattern of blood vessels coursing through the lungs with the areas of blackness that represent the main windpipe branching into the lungs. So that's a pretty normal looking part of the lung. As I use the scroll button to move up and down through the body, you can see we're looking at images through the lungs up and down. Now down at the bottom, we're seeing the abdomen, the liver, and so forth. As I move up closer to the top, we start to see the main windpipe here in the middle. And now we're up very close to the top, and now you can see this small tumor. It looks like it doesn't belong, and it doesn't. That tumor is only about an inch big, but you can tell that it's very easily seen with the CAT scan. The resolution of the CAT scan is so good, we can see millimeter differences in the size of that tumor. So we know that tumor doesn't belong there, and that turned out to be a cancer. The other thing we can see with the CAT scan are lymph nodes. If you watched my video on lung cancer staging, you'll remember that we talked about the importance of lymph nodes. When cancers begin to spread, the first place they usually show up are in lymph nodes, and we can see those lymph nodes on the CAT scan. Now I can't see them with this window. I'll change it back to that first window we saw. And the lymph nodes show up in this area around the main windpipe. Now in this patient, we don't see very many large lymph nodes, but there are a couple. For example, that structure there, that's a lymph node sitting right next to the windpipe between the aorta and the vena cava. So these are two major blood vessels and then a small lymph node. Sometimes when cancers involve the lymph nodes get to be very large, and we can see them on the CAT scan. The other things we can see on the CAT scan relate to whether the cancer has spread to the surface of the lung or the pleura. Sometimes we'll see a small amount of fluid in the CAT scan. And sometimes we can even see if it has spread to involve the liver or the adrenal glands. But the main purpose is I wanted to show you here what a CAT scan looks like and how to understand how to read it. Now a CAT scan really is an X-ray. It's a fancy X-ray. And it shows us pictures in black and white that represent the density of the tissues. Air shows up black, calcium shows up white, and everything else is in between. Most lung cancer patients now have a test called a PET scan or a PET-CT. PET is spelled P-E-T, and it stands for positron emission tomography. That's a nuclear medicine study. In other words, the patient gets an injection of a small amount of radioactive sugar or glucose. It's a test of metabolism, because what happens is that glucose travels throughout our body, and our cells absorb the glucose because they want to use it as a fuel source. So areas of our body that are using a lot of energy, that are very active, have high metabolism, they show up bright on a PET scan. Areas that are not using any energy don't show up at all on the PET scan. So the PET scan is a test of metabolic activity. It doesn't tell us what things look like, not really where they are, but it tells us whether they have a high metabolic rate. So for example, the heart, which is constantly beating, uses a lot of energy, and it's normal to see the heart show up very bright on a PET scan. A lung tumor, on the other hand, may not show up bright on a PET scan. Some cancers are very bright. That's what cancers do. They grow, they use a lot of energy. So most cancers show up bright on a PET scan. But there's some cancers that have a very low metabolic rate, and the PET scan is negative. Now, by the same token, an infection in the lung will show up very bright. An infection is an area of inflammation where the body is responding. There's a lot of activity there, and so that will show up bright on the PET scan also. So one of the things I caution my patients is that a PET scan is not a cancer test. Just because it's positive on the PET scan does not mean that it's cancer, and just because it's negative on the PET scan does not mean that it is not cancer. The PET scan is not perfect. It can miss areas of cancer. But when we put the PET scan together with a CAT scan, the overall result is a very accurate result, usually better than 95% accurate. Now I have a PET scan of this same patient, and it'll show you how that tumor lights up on the PET. So here's that same tumor, and you can see the color scheme shows that it's yellow. The scale shows you that yellow is very, very bright, a lot of metabolism. You can also see the lungs and the rest of the body don't show up bright at all. Now this is actually a hybrid view. The PET scan image is superimposed on a CAT scan image, so you can see the structures. Normally just with the PET scan you don't see the structures. So the combination of the PET and the CAT scan gives us the ability to identify the tumor and its location. And we could also look for lymph nodes. If there's cancer in the tumor and that's showing up bright on the PET scan, and there's cancer in the lymph node, we would expect the lymph node to be bright on a CAT scan. In this patient, the lymph nodes don't show up on the PET scan. So the combination of not seeing them on the CAT scan and not seeing them on the PET scan is a very good predictor that they're going to be negative. Not always. Sometimes we have to biopsy the lymph nodes. Sometimes, if the nodule is very tiny, we can wait and see if it grows. If it grows, that's suspicious, and we'll either want to biopsy it or remove it. If the tumor is large enough, then we can do a biopsy. Typically, that biopsy is done with what's called a needle-guided biopsy. I've explained to you how to understand what the picture on a CAT scan is showing. So I have another image here to show you an example of a needle biopsy. Those are typically done by the interventional radiologists. Those are radiology doctors who specialize in targeting sites for biopsy. So the patient is placed on the CT scanner table, the tumor is localized on the CT scanner, and then the radiologist gives a small amount of Novocaine at the level of the skin and puts the needle directly through the skin into the tumor. This is a very safe procedure. It's done thousands of times all across the country every day, and the risk of complications is very low. Typically, a successful biopsy can be done for tumors even as small as 1 centimeter or ½ inch. So I have a picture here to show you what I mean. This is a CAT scan of a patient who had a fairly large tumor growing in the upper part of the right lung. You can see it here on the CAT scan. This clearly looks out of place. That's a pretty large tumor, and it should be fairly easy to get a good biopsy. So a few days after this CAT scan was done, the radiology doctors did a biopsy. And this is a picture of that biopsy. You can see here's the tumor in the right lung, and here's a needle going through the skin directly into the tumor. They can get a little tiny piece of the tumor that can be looked at under the microscope and can give us a diagnosis. This is a very accurate and very safe way of biopsying a lung tumor. There are other ways to biopsy lung tumors. Sometimes if the tumor is fairly central in the windpipe, we can go down the mouth with a camera. It's called a bronchoscopy, and go out into the part of the lung where the tumor is found and take a small piece. Usually, though, we can't see the tumor, so it's not quite as accurate as taking a biopsy where we can see the needle going into it. There's another form of biopsy called navigational bronchoscopy. That's where we use computer guidance to help us find the tumor in the lung and take a biopsy that way. That's a fairly sophisticated virtual reality system that has good success with tumors that are farther out into the lung. A needle biopsy is fairly safe, but one of the risks we do have to know about is called a pneumothorax. As you can see on this picture, the needle does have to go through the lung to get to the tumor. The lung, of course, is filled with air, and so if you puncture the surface of the lung, it can leak air into the chest and collapse a little bit. That's called a pneumothorax. The risk of a pneumothorax with this procedure is fairly low. And in fact, most people, even with a small pneumothorax, don't need to have anything done. If the pneumothorax is somewhat larger and the patient has some breathing troubles with it, then we put a small drain in the area to suck out the air until the air leak heals. Usually patients stay in the hospital overnight, sometimes a little bit longer. But the chances of that happening are very small. For most patients, a needle biopsy is very safe. They go home the same day with no problems. But what I wanted to get across today was the concept of looking at your imaging, looking at the CAT scan, looking at the PET scan, and knowing how to understand what it's telling you. Thank you.